Hi, Lisa Broyles with Way 2 Health MD, and this is another video in my perimenopause series. And today is a topic that not a lot of us want to talk about, but affects many, many women, and that's urinary incontinence. So as you approach menopause, certainly if you've had a hysterectomy, you probably notice that when you bend over or you cough or you sneeze or you laugh, and a little bit of urine leaks out, and it's really embarrassing, and it's very, very common. I see it in my patients all the time. And like I said, if you've had a hysterectomy or any procedure, it tends to weaken your pelvic floor muscles, and you're going to have even more trouble with urinary incontinence. Sometimes after having babies, the uterus can start kind of hanging out of the vagina or the bladder, and that's called a prolapse. Okay, so that can be very uncomfortable and painful, and usually has to be surgically corrected. But if you are starting to notice that you are leaking when you cough, sneeze, bend over, driving you crazy, there are some things that you can do for it. First of all, your doctor probably has talked to you about Kegel exercises. You can do them anytime, but the most effective way is when you need to go to the bathroom, you sit on the toilet, and before you let the urine out, you pretend that the floor of your vaginal tissues there is like an elevator, and you pull it up tight, and then you slowly release it floor by floor. And imagine an elevator lowering floor by floor with that pelvic muscle. And then you let out some urine, and then you stop, and you pull that floor of that elevator up, and then you let out a little urine. So you're controlling it, okay? And you can actually tighten those muscles in that pelvic floor to help you decrease your urine leakage. That doesn't always work just by itself. You can actually purchase Kegel balls, little vaginal weights that you have to hold intravaginally, and that definitely strengthens your pelvic floor. The other thing I would suggest, physical therapy. You can get a referral from your primary care doctor, and our physical therapist can teach you pelvic floor exercises as well. So they do work. They also work really well in combination with a little bit of topical hormone therapy. So you can discuss with your doctor about a little bit of estrogen cream that can be compounded for you or available via prescription from a regular pharmacy. And you can apply estrogen topically a few nights a week. Now, if you've had your uterus out, you can put just estrogen safely several nights a week, and it will strengthen your pelvic floor muscles and help with urinary incontinence. If you still have your uterus, you need a little bit of progesterone too to balance that out. I recommend that you also have a little bit of DHEA in your compounded estrogen cream. DHEA penetrates those muscles a little deeper and gets into that perineal pelvic floor and helps strengthen those muscles in tandem with estrogen. So the ideal is a little bit of topical estrogen and DHEA along with some oral progesterone like we talked about in the last video to help with our joints. It also prevents any kind of uterine cancer from using topical estrogen. So this can be done during perimenopause when the urinary leakage starts, and yes, it can resolve. Now, if it's really severe, if you have a pelvic prolapse, you may have to have some kind of surgical procedure, but most women can control it with the Kegel exercises, pelvic floor therapy, and the right topical estrogen DHEA. Thank you.